Episode 0. Welcome to the Vitals and Values podcast. This has been a few months in the making, and actually probably a few years in the making for you, because before we even get into too much detail here, Lara and her sister years ago thought about building a podcast, bought these mics.
Sure did.
And started the process, and finally, through my kind of insisting, we had the opportunity to bring this together.
Well, it's helpful when you have someone like yourself who can do a lot of the work for me, so I don't have to do it all myself.
This isn't my first rodeo on a podcast. Exactly. Shout out to John Arpino. We've been doing this for a hot second now. So
yeah, I think this was like a post-COVID thing. Sitting in my kitchen trying to make a podcast. Yeah, that was a thing.
That was like everyone started podcasts. If you made it past 7 episodes, you're kind of a big deal, actually. Like it's like top 10% of all podcasts never make it past 7 episodes, I think.
Well, ours never made it to 1, so this is a much bigger success already.
Yes. And just like you and your sister, and I'm the same way, if I'm going to do something,
do it good.
Right. So it's like we have a whole set built out in your practice. Super cool that we had this opportunity to do that.
And shout out to Josh Sycama for telling us how to put together a really nice studio.
We lit it. Josh, hopefully this is up to your standards. Hopefully. Appreciate that. But yeah, so let me kind of give you the 2 cents vision overview of Vitals and Values and why we're here. So main vision here, there's just so much, obviously, fluff on the internet. Everything's being sensationalized.
Misinformation.
It's brutal. And personally, if anyone knows my social media, I'm a little more than just weight loss guy. I like to talk about more depth of different things, cardiovascular risk, all this, shout out to Dad, and all this kind of stuff. And so for me, I wanted a podcast that had more of all of health and nutrition and even other things.
Yeah, I think for myself, I know that there's so much misinformation, like you were saying, online about health, and I want to bring truth to a lot of that. And the understanding that health is not black and white, and there's a lot of nuance to it, which I think a lot of times that is missed on social media.
100%. And so for anyone listening in, we haven't done it yet, but quick introductions for myself, and then Lara can do hers. My name is David Roden, and I've been down 200 pounds for over 10 years now. And so I've been in the obesity transformation space. Have a documentary coming out called The Anti-Diet Diet Club. That whole world of obesity is obviously personal to me, but going more depth of everything health, nutrition, and even obviously my faith, Christianity and Jesus is very important to me. And so diving into how that kind of all aligns is also important. And for me personally, context and nuance is everything. And I think that's where the podcast for me is super important, where we can talk about the hard facts, but then develop into that. And so for you...
So my name is Lara Bottenberg, and I am a family medicine physician in Grand Rapids, Michigan, and I guess we're both in Grand Rapids, Michigan. But so I worked for several years for a large healthcare system, and just in the past 8 months have started my own concierge medical practice. And for people that aren't really familiar what concierge medicine is, we are trying to really focus on our patients and what they actually need in this type of practice. And we do that by kind of taking the insurance piece out of the practice. And we use a membership model so that we are allowed to keep our patient panels a lot smaller, so we can get to know our patients. We can provide them better care, better communication, longer visits, just a lot of the things that patients are looking for in primary care and they aren't getting, because so I started this practice with my sister, who is also my twin. Her name is Jana. And so we both saw that patients were frustrated with the healthcare system as it is currently. And we knew that we had to do something different for our patients, and so that we could practice medicine how we feel like it should be practiced. And so we started our own practice last year.
And I freaking love the fact that it's a weird combination as we're kind of getting more depth of your backstory, my backstory, and how this podcast is developing into it. It's super fun that you and your sister, and I think it's rare in today's world, where in the medical world, it seems like the polarity between the two groups is just like in everything, is either traditional medicine, status quo, leaning heavy on pharmaceutical intervention. Not that pharmaceuticals are bad.
We use them all the time.
Yeah, but it's like it doesn't take away from lifestyle intervention and how important sleep, nutrition, fitness, your mental, all this stuff matters. And I've always very much admired you and your sister, where it's so easy in your position that you guys do lean on lifestyle medicine. If you get into the different practices that help limit the opportunity for diseases, guess what? You don't have to prescribe medications, but you're not against them. And you can't, it's really hard to do that in a traditional medical world where your insurance and you're 6 minutes with a patient.
Right. And I think that patients patients are frustrated with healthcare because they only get 6 minutes with their doctor, for example, but they don't understand why that occurs always. And the physicians are frustrated with it too, but not all physicians go to try to do something to change that. And so it was interesting because so my sister and I never wanted to start our own practice, and we did not want to do it together. And we always said we would never do that, but we just saw that the need was there. And we kind of it was a slow transition to making that decision. And we were sitting around because we were living together, and we were in our house during COVID, and we were talking about things that we could do to try to help our patients better. And so the first step that we took is we did a fellowship in integrative medicine through the University of Arizona. And that kind of was what you're talking about, with a little bit more of, instead of just talking about pharmaceuticals and Western medicine, is bringing in some other modalities that patients are using and have been used in different parts of the world for long periods of time. And so just getting a greater knowledge on some more of the nutrition, the lifestyle, the exercise, knowing more about supplements and which ones you actually should take or are actually helpful for patients. And so that was kind of our first step in change, I think. And then over the next couple of years after that, we started the idea of starting our own practice. And I think the fellowship did help us in that, because we saw that there are people doing other things. They're not just sticking in traditional healthcare in this large corporate system. And so I think that was a really helpful step in getting us to where we are today.
Love it. And now kind of just breaking down this podcast and the function and the flow of it. I think it's super important. So as you guys listen to every episode in the future, there's 4 main processes of how every single episode will be broken down. Number 1, you have Vitals Check. And so Vitals Check is the hard science. This is 3 to 5 minutes, just numbers, where Lara is going to go into the detail of whatever topic we're going over. What do we know? And here are the meta-analyses, systemic reviews, clinical research that backs that claim.
Subjective parts to this.
Just what do we know? And we can actually kind of gravitate towards. Now, the problem with that is there's so much we don't know.
Yep.
There's so much we know, but so much we don't know. And so Vitals Check, 5 minutes, it's just going to be what we know. And then number 2, as we break it down, we got values and focus, because values and focus allows for some more nuance that we can kind of develop on from a personal experience, where yes, the data says one thing, but we just don't have, there's a lot of nuance.
Right. Well, I mean, I kind of said that earlier, how everyone kind of makes it black, or a lot of people make it black and white. And I think this section goes into why that's just not very accurate. And so I think that's going to be a helpful part to saying, hey, we have the science, but there's so much more.
100%.
Because in medicine, we do a lot of evidence-based medicine is the term, which is that data piece. But I do think when you're only focused on evidence-based medicine, which I do like, but I think when you only focus on that, you are missing some pieces.
There's huge, and that's where the naturopaths, the holistics, all this kind of stuff, they're willing to talk about that angle. Now, the problem is they somehow just overlook hard data and
they go too far sometimes.
Yeah, they just go. And so it's important we talk about some of the a great example going into it's when we talk about detail of GLP-1s and weight loss surgery and weight loss medications, there are some scary studies that people use without understanding context. And then when we go into values and focus, we can break them down going, hey, while yes, here's the data, I'm not too concerned about it for these reasons. That you can break down and give context to. And then number 3, we have the honest table, where this is where we can, contrary to popular belief, Lara and I in particular, we don't agree on everything. Like, for example, vegetables are carbs.
No, they're not.
They're carbs.
Okay, come on, people, back me up here. This is a ridiculous argument.
They are fundamentally macronutrient-wise, most vegetables are carbs.
They
may
are
not be very
non-starchy
calorically
vegetable.
dense. Broccoli is still a carb. It's still a carb.
Just because it has carbs does not mean it is a carb.
So contrary to popular belief, when we get into the discussions and we talk about this, number one, Lara and I will obviously have our own opinions on things and we can develop it into them. And number two, I think it's important in the discussions in this roundtable, we acknowledge other people's points of view and we bring them into this circle. So whether we have guests come in to give their point of view, or we try to discuss more detailed on it, a lot like what we hear on social media, breaking that stuff down, a lot of the problems there. And so the discussion table is going to be like 15 to 20 minutes where you get more depth, more context, more nuance, more personal. And then finally, like the finishing point is like takeaways. So like, all right, you listen to this 45-minute episode, 5 minutes on hard data, 15 minutes on giving more context to the data, 20 minutes on developing the different, how people are going to see this and people's opinions on it. What does it all mean? Getting like, all right, nitty gritty, how can you actually tangibly from this topic create a shift in your health?
I like it.
That's the plan.
It's going to be great. And we have a Instagram.
We have Instagram, we have TikTok, we have social media, we have pretty much everything.
We have an email.
We have an email.
Okay. So I was like, people, tell us what you like. Tell us what you want to hear.
100%.
Give us feedback. We want to hear from you.
Constructive criticism is everything. So if you guys have any questions, comments, or topics going on right now we have 5 in the tank that we already have planned. We're recording now. But this is obviously a collaborative effort with everyone too. So like patients of yours, friends of mine. What's nice about the topic, like the angle we're playing on, this is pretty much everything health and nutrition based, but it's obviously, I think it's super important. We can break down an episode on, I think in the future, on where medicine is actually missing the mark, like concierge medicine and why this is happening and where the insurance problem is. And like everyone blames the doctor. And the majority of the problem right now has nothing to do with the doctors.
I mean, not all doctors are good, but there's bigger problems there.
So a couple. We have 5 episodes in the tank that we're planning on. But yeah, comment down below any types of topics you would like to hear. DM us, and we're looking forward to creating a collaborative context. Just like what you guys are doing in concierge medicine, giving the time and the nuance to take somebody and understand, just stopping the clickbait. And like, guys, it's never that simple. Like carbs are the enemy. All pharmaceuticals are bad. Every illness comes from the gut. Like all this crap. Like if it has these hard clickbaity lines, it's probably nonsense.
Let's talk about the truth.
Let's get to I think we're at a point where everyone just wants health, and really everyone's all over the place. And so health, happiness, and breaking that all down through a medical lens and obviously the spiritual lens. I think it's super important. There is a level of faith that comes in when it comes to your health. It's not all ones and zeros.
Teach us in medical school, it's mind, body, and spirit, right?
Yeah. And so looking forward to creating a really good cohesive message between all 3 of those. So we appreciate you being on with us and watching this episode, and looking forward to having this be educational for everyone. If you guys find this valuable, please share it to your friends and family, especially on different episodes. Be careful coming off as passive aggressive. When we talk about Ozempic and you said it to all your friends, saying, "You told me I'm fat," like, we'll see what happens.
Stay tuned.